is the headquarters of our company. All of the devices are being developed, produced, and manufactured inside this building. We do also have two global trainings, two international trainings every year, which are done inside the headquarters of Alexion AG in Germany. This was the picture for 2019 training. It was supported by Genoa University from Italy, and it was done inside Germany in our headquarters. So we were supposed to do that this year, but unfortunately, because of the COVID-19, all of our activities were being on hold. So currently on 2021, we will be able to do our activities again. Usually we do have two international training in Germany, plus we do also have continuous education and support locally in each country. So if everything going fine, we will be doing also a lot of activities in Myanmar. We do have the factory is based in Singen, the city in Germany, in which we produce, develop, and manufacture the devices. We also have a service, after service and maintenance centers in Germany and in Dubai, Tokyo, and Shanghai. These centers are responsible to make the maintenance and the after sales services of our devices. So for example, if you have any problem with your device, you will be sending your device to the nearest service center to your country. Plus, we do have also around 5 training centers in Zingen, Dubai, Cairo in Egypt, Ulaanbaatar, Mongolia, Moscow, and Shanghai. All of these training centers also are responsible to make the training for our customers, our engineers. So also our dentists will be invited to attend the training in these centers. On the screen in front of you, you can find all of the links of Alexion AG, Facebook, LinkedIn, Instagram, in which we will post all of our activities. We also have something called the study club. It's called Alexioneers. In this study club, we always post new cases from different dentists internationally to share with you different techniques, and also we post a lot of information about laser books. Everything you need to learn about laser, we always post on our website. Right now, I'm going to give you like a short introduction about the laser basics and physics in general, not only about Alexion. So let's say in the first 20 slides, we will be speaking on in general about all of lasers in the market. So first, you have to know that any laser device consists of two main important components. The first part is called the production unit, and the second part is called the delivery system. Both of them are inside the unit. The production unit, you will not be able to see it because it is inside your device, so you don't see it, but you will be able only to see the delivery system. The delivery system, which is responsible to take out the laser from the production unit and deliver it to the patient's mouth. The production unit consists of four main components. The first one is called the laser source or the laser medium. Then we have something called the stimulating source or the stimulator. Then we have the 100% reflecting mirror. And finally, we have the semi-reflecting mirror. So this is the components of the production unit. From the production unit, we will be able to produce the laser. Here is the production unit. You can see it is inside your device. You will not be able to see it by your eyes because it is inside. But you have to know this information because if you are going to study a master degree in laser, or if you want to do a more detailed research or something about laser, you have to know this information. So first, in between, we have we have the laser source or the laser medium in this part. Then the laser medium, you can produce laser from different kind of materials. You can produce laser from a gas or from a semiconductor or a solid material. It depends on it depends on the device that you have. So some devices, they can produce the laser from a gas, from a dye, from a solid material, or from a semiconductor. So there is a lot of different laser sources in the market. Then we have here the yellow part. This is called the stimulator or the stimulating source. And the stimulating source or the stimulator, it can be a light, it can be a source of heat, or it can be a source of electricity. Then on both of the sides, we have the 100% reflecting mirror, and on the right side, we have the semi-reflecting mirror. And at the end, this device is totally covered by something called the reflecting tube, so it can condense the energy of the laser. Here is the mechanism how the laser is being produced. So first, we will have the atoms, or we will have the laser source inside the tube. Then we will have the stimulator. The stimulator is going to produce energy. This energy is going to make the laser source to become excited. The atoms of the laser source is going to be moving and emitting photons. Then this energy and these photons is going to be reflected by the 100% reflecting mirror, and then it go out from the semi-reflecting mirror. So this is simply the mechanism of how you can produce any kind of laser, not only dental laser, but any kind of laser. It depends on this mechanism. Then we will go to something called the electromagnetic spectrum. And the electromagnetic spectrum is responsible to tell you what kind of wavelength your eyes is going to see. So if you are going to speak about any visible light or invisible lights, all of these lights, both of them have a wavelength. Our eyes can see between 400 nanometer and up to 700 nanometer. So if we have any kind of light or any kind of laser which has a wavelength under 400 or having a wavelength above 700, simply we will not be able to see it. So if we speak about the gamma rays, X-rays, and UV, all of them are invisible because all of them are under 400. And if we go to the infrared, microwaves, and radio waves, all of them also we cannot see them because they are above 700. If you can see the picture in front of you, when we move more toward the 400 part, you can see that the color change simply from yellow to green, blue, and finally to violet. And if you go more to the 700, you can see that the colors are starting to take the yellow, orange, and red. So most of the dental laser and also the laser which is being used in medical field, I can say that 80% of them are invisible. We are not be able to see it because most of them, they have a wavelength above 700, except there are few type of lasers which we can see with our eyes. We will speak about them in the next slide. Here is a small comparison between the laser beam and the normal light. So if we are going to speak about the laser is a monochromatic, which means it has only one color. If we compare it with the normal lights are polychromatic, which means it has different colors and different shades in the same beam. The laser it have a parallel waves, but with the normal lights, it doesn't have a parallel waves. That's why when you turn on your lights at your room, you can see that the light is totally scattered in the room, so it covered the room. But with the laser, this doesn't happen. Once you turn on your laser is being directed. It has a high intensity beam, and it moves together with the movement of the laser source. So if you move your hand to the right side, the laser is going to move with that. And if you do it with the left side, it is going to move. But with the normal light, it's totally different. Once you turn on your normal light, the light will be scattered in the whole room. So in conclusion, we can say that the laser has only one color. It doesn't matter if you see it or no, because sometimes we have a laser which have a wavelength above 700 or 400, and both of them you will not be able to see them. But that doesn't mean that they don't have a color. They have a color, but you don't see that color. The laser beam has a parallel waves. The laser beam is directed, and it is having a very high intensity. Then we go to the most 5 important points if you want to do your application correctly in dental in when you use the laser in dentistry. First, you have to know five main points. The first one is called the wavelength. Second one is the power. Third one is the application time, and the fourth one is operation mode. And finally is the distance between the laser handpiece and the tissue. We will go about each one. First, we will speak about the wavelengths. The wavelength is measured by the nanometer, and the wavelength is responsible to tell you how is your laser is going to be absorbed by the human tissue. So we have lasers which are absorbed by the soft tissue. We have lasers which are absorbed by the hard tissue, and we have also some lasers which are absorbed by both of the tissues. How the laser is going to be absorbed by the human tissue? First, you have 5 main chromophores, or 5 main, let's call them 5 main components which are responsible to absorb the laser energy or absorb the light energy. The first one is the hemoglobin, then melanin, protein, water, and hydroxyapatite. So those are the 5 main components responsible to absorb the laser energy and also the light energy. So if we have a laser which is absorbed mainly by hemoglobin, melanin, and protein, we can say that this laser is mainly targeting the soft tissue, because the soft tissue is full of hemoglobin, melanin, and protein. And if we have a laser which is mainly absorbed by the water and the hydroxyapatite, we can say that this laser is mainly targeting the hard tissue, because all of our hard tissues, such as the bone, enamel, dentine, is mainly consist of water and hydroxyapatite. On the picture in front of you, you can see that we have different wavelengths of laser, and every wavelength is mainly absorbed by a specific part of our body. So we will go first with the diodes. You can see we have different wavelengths of diodes. So we will speak first about the 810. You can see that the 810 is mainly absorbed by the melanin. It has a very high absorption in the melanin, and with the hemoglobin and the protein, it has also a good absorption level in the melanin and hemoglobin, sorry, in the hemoglobin and in the protein. And in the water, you can see the water, it has a very low absorption, and in the hydroxyapatite, it also have a low absorption. If we go to another wavelength, which called the 940, and this is mainly the wavelengths of biolaser. So Electron, we use the 810. Biolaser, they use the 940. It has a lower absorption in the melanin if we compare it with the 810, and it has a better absorption into the hemoglobin, and in the protein, hydroxyapatite, and water, it also have a higher absorption in them. So what does that mean when you do the application? It means if you are going to do a depigmentation of the gingiva, if you want to remove the dark color from the lips, from your gingiva, if you want to do the surgery, the 810, it will be better in that part, because it is mainly absorbed by the melanin. So you will have less carbonization when you cut, especially when you saw the video in the beginning of this presentation. You can see that we are cutting the tissue with the minimum amount of carbonization at all. So we usually have a very, very low level of carbonization because our wavelength is mainly absorbed by the melanin. Then we go to the wavelength, it's called 980, and this is one of the most popular wavelengths in the market. You can find a lot of companies which is producing 980, such as Sirona, Soleils. A lot of companies are using these wavelengths. It is very old at the meantime, and it has a very high absorption into the hemoglobin, but it has a lower absorption into the melanin if you compare it with the 810. It has also a higher absorption into the water and hydroxyapatite. So what does that mean? If you are going to use the 980, for example, to do a depigmentation of the gingiva and make surgery, it will make the surgery very good because it has a high absorption into hemoglobin, but it will make carbonization because there is a lot of energy which is absorbed by these wavelengths on the soft tissue. So when the hemoglobin absorb the energy of the laser, it will increase the temperature of your hemoglobin, and that will lead to carbonization, especially if the dentist is not professional when he's using his laser. Then we will go to another type of wavelengths, which is called the blue laser. And the blue laser, it has a wavelength of 455. You can see it on the screen. Here is exactly where the blue laser is taking place. So the blue laser is visible. The dentist can be able to see it. If we compare it with the 810, 940, and 980, all of these wavelengths, you cannot see them by your eye because all of them are above 700. But if we speak about the blue laser, you can see it with your own eyes. It has a wavelength of 455. You can see it has a very, very high absorption into the hemoglobin and also very high absorption in the protein. So this laser is very good if you want to do the surgery, but it has two main problems. The first one is because this laser is visible, so the dentist have to wear very dark glasses to be able to see the application field. And the second disadvantage of this laser is you cannot do low-level laser therapy with it. So the 810 and 940 are better to do this application. So if you want only to make surgery, then the blue laser will be better. But if you want to do a lot of applications such as surgery, static, and low-level laser therapy, it will be advised to use the 810 because it gives you a very wide applications to use. Then we go to the hard tissue lasers. We will first speak about the erbium chromium. You can see here is exactly where is the erbium chromium stay. It has a very high absorption into the protein, very high absorption into the water, and also high absorption into the hydroxyapatite. So in the melanin and in the hemoglobin, it doesn't have any absorption at all. So that means that this laser is mainly going to target the hard tissue. Then we go to another type of lasers called the erbium YAG, and this is also one of the very popular dental laser in the market. It has a very high absorption into the water and also very high absorption into the protein and hydroxyapatite. So that means that this laser is also going to target the hard tissue. Then we go to the CO2, and with the CO2, you can see it has a very, very high absorption into the hydroxyapatite, very high absorption into the water, and also very high absorption into the protein. So that means that the CO2 is also going to target the hard tissue. Here is a small comparison between different dental laser in the market and how we can classify them. So first, if we are going to speak about the soft tissue lasers, we have the blue laser, of 445 or 455. It has two wavelengths. Then we have the diode family, which is 808, 940, 970, and 980. Then we have the Indiag and the CO2. All of these lasers, they have an effect on the soft tissue. Then we go to the hard tissue lasers, but these hard tissue lasers can also have an effect on the soft tissue. We have the erbium chromium, we have the erbium YAG, and also we have the CO2. And these lasers, they are mainly targeting the hard tissue, so you can cut the enamel, you can cut dentin, you can cut the bone with this laser, but you can also cut the soft tissue, but you will have one main problem is called the bleeding. So if you are cutting your soft tissue with any type of these lasers, mainly you will have a bleeding because there is no absorption into the hemoglobin. So if you are going to compare the erbium YAG, erbium chromium, and the CO2 together with the diode laser, with the diode laser you will not have bleeding when you cut the tissue, but with the erbium and erbium chromium or erbium YAG and CO2, with them you will have bleeding because there is no absorption into the hemoglobin. Then we go to another family, it's called the low-level laser therapy or the biostimulation or biomodulation. All of them are names for the same thing. We have also the diode, we have the KPT, which is a green laser. Then we have Keras detection laser. Those also are diodes, and they have a wavelength of 504 and 655. Both of them are visible, so the dentist can see them with his own eyes. And finally, we have the polymerizing and the bleaching lasers, which is used in your clinic with the composite or with the bleaching. And usually it has a blue color because it is mainly, and also it is visible, and it is also, its shade is mainly because it is very near to the 400 nanometers, so it will have mainly a blue color. Here is a small comparison between the different wavelengths of diodes in the market. So as we spoke already about the 445, the blue laser, this laser is mainly absorbed by the hemoglobin and the melanin. It is very good for the soft tissue surgery. It has a very high cutting efficiency because it has a high absorption by the hemoglobin, but it has two main disadvantages, which is this laser is very glowy and you need to wear very dark glasses to be able to see the application field. And it also has a very, very high unnecessary cutting efficiency. So if the dentist is not really professional when he is using this laser, he may do some damage to the patient. So it requires a very high skills of the dentist. Then we go to the 635. This laser is also absorbed by the hemoglobin and the melanin. It is mainly used for biostimulation. It has a very, very low power and it is only suitable for biostimulation. So this laser can improve the healing process. It can decrease the pain if the patient is having some pain in his TMJ or some muscle pain. This laser will be suitable for that, but it is not enough to cut the soft tissue. Then we go to the 808 or 810. Mainly it has a high absorption into the melanin. Then also it has a good absorption into the hemoglobin and a very low absorption in protein and water. It means that this laser will be very good for the soft tissue surgery and biostimulation. The main advantage of this laser that it can do soft tissue surgery very good, and it is also very safe because it has a minimum penetration depth into the tissue, which is maximum up to 2 millimeters penetration depth. So that's very good and also very safe for the dentist when he is using this laser. Also, the 808 has an advantage because it can improve the production of the collagen. So that's why in Election, we have the ability to treat the patient who complain from snoring, because we depend mainly on the collagen production to treat the patient who complain from snoring when they sleep. The disadvantage of this laser that it doesn't have any absorption into the water. The absorption is very, very low. Then we go to the 940. 940 mainly has a very high absorption into the protein, hemoglobin, and melanin. So it is also good for the soft tissue surgery and biostimulation, but it has a disadvantage that it can make some burn in the tissue because it has a very high absorption into the protein, and the protein is very sensitive to the heat. So when you cut with this laser, if the dentist is not professional, he may burn the tissue and he may make some carbonization. Finally, we go to the 980. This laser has a very high absorption into the hemoglobin, water, and it has a low absorption into the melanin and the protein. It is also good for soft tissue surgery and biostimulation, but it has a problem in case if you are treating the patient who complain from hypersensitivity. With the 980, you may increase the sensitivity for the patient because this laser is absorbed by the water, and inside your dentine tubes, it is full of water. So when the dentine tubes absorb this energy, it will increase, it will make some itching effect in the dentine tubes, and then it will also increase the diameter of the dentine tubes, which means that the patient is going to increase the sensitivity when the sensitivity to the temperature. Then we go to the hard tissue lasers. As we spoke already, we have three main lasers that we can use in our clinic. So we have the laser devices. We have the I'm sorry, I think we got disconnected. So let's go back to this comparison. So we can say that the CO2 is the strongest one to cut the hard tissue. The erbium YAG is also very strong, but it is much more stronger than the erbium chromium. And the main disadvantage of these devices that they are very expensive. So and also they are not as fast as the handpiece which you use in your clinic. So if you want to do a class 1 or a class 2 cavity, I think the turbine or the handpiece, it will be much more faster than these lasers, especially if we are speaking about the cost, because these devices are extremely expensive, and also they require a very high skill of the dentist when they use it in the clinic. Then here is a small comparison between the laser and the conventional treatment in your clinic. So with the laser, you use less anesthesia for the patient, but with the conventional treatment, usually you have to inject anesthesia. So with the laser, sometimes you don't need to use anesthesia, or you can use only a topical anesthesia. But with the conventional treatment, sometimes it is a must to use the anesthesia. With the laser, you have less bleeding, especially if you are using the diode. So the bleeding will be very, very, uh, um, very low. It will be um, to a minimum level. But with the conventional treatment, bleeding is something usual. With the laser, you don't need to do sutures, but with the conventional treatment, most of the time you have to do suture and stitching. With the laser, you have a very clear application field, so the dentist can be able to see it correctly. But with the conventional treatment, the application area is affected by the bleeding, and the dentist sometimes he doesn't really see, and he need to stop the application to clear the blood. But with the laser, you don't have that part. With the laser, you have a very fast recovery and healing, but with the conventional treatment, it is less than that. Regarding your request to send the presentation, so after I finish, I will send you this presentation on your email. So then we go with the dyed laser again. Dyed laser can disinfect and decontaminate the soft tissue, but with the conventional treatment, usually there is no disinfecting effect. So if you are cutting with the scalpel, you will need to use some disinfecting liquid, but with the laser you don't need to do that because the laser itself can kill the bacteria and the viruses in the application field. Then we go to the time. So with the laser you can cut very short in a very short time, but with the conventional treatment sometimes the treatment time is very long. The laser is very, very suitable to the pregnant woman and the children. So in case you have a pregnant woman and you want to do a treatment for her, the laser will be the best choice for that because most of the time you don't need to inject anesthesia. So the laser is very, very suitable to the pregnant and the children. But sometimes the conventional treatment, you have some limitation if you are treating a pregnant woman because you need to inject anesthesia and that will be a problem for her. Finally, with the laser, you have a very less post-operative complication and discomfort, and you don't, most of the time you don't need to use antibiotic or any medications, but with the conventional treatment you have a very high post-operative complication, and you also need to use some antibiotics after the treatment. Then we will go to the power. If you remember in the first slide, we spoke about 5 main important points for the laser, which is the wavelength, power, application time, and operation mode, and the distance between the handpiece and the tissue. So we will speak about the power. The power is measured by the watt. So if you increase the power, you will increase the cutting efficiency. If you decrease the power, then you will decrease the cutting efficiency. It is very simple. High power will cut more, less power will cut less. Some applications, we need to increase the power, and other application, you don't need to increase the power at all. So I will let you know how we can measure the power. So usually if you have a very dark gingiva, that means that you have a very that this gingiva is mainly full of hemoglobin and full of melanin. That's why it has a very dark color. So in that case, you have to decrease the power because the absorption will be very high. And if you have a gingiva which is has a pink plain color, that means it has less amount of chromophores or less amount of melanin and hemoglobin. And in that case, you need to increase the power to be able not to burn the tissue. So darker tissue means you decrease the power, and lighter tissues, it means you increase the power. Usually for the soft tissue, you don't need to use more than 2.5 watts. So 2.5 is mainly very high to cut the soft tissue. Usually for myself as Jad, when I use it in the clinic, maximum I don't exceed 1.8. So for me, 1.8 is very good to cut the soft tissue. Then we go to the application time. The application time is measured by the seconds. So I just want to explain one important point about the laser. If we are going to compare between laser and the surgical knife or the scalpel or the blades, with the scalpel or with the surgical knife or with the blades, when you push more, when you apply more pressure on the soft tissue, you will cut more. But with the laser, it's totally different. With the laser, we don't do any pressure on the tissue. So we don't push the tissue at all. We just try to be slightly touching the surface of the soft tissue. So we don't do any pressure at all, because simply if you do pressure, nothing is going to happen. So the laser depends on the time. The longer you stay on the surface of the tissue, the better the effect is you are going to have, because at the end, laser is some kind of a light. So you need to give your soft tissue some time to absorb the energy of the laser. If you work very fast, you will not give enough time for your tissue to absorb the laser energy, and finally you will not be able to cut the soft tissue. But if you work slowly and you give enough time for your tissue to absorb the laser energy, then you will be able to cut. So try to work as slowly as you can, so you can give enough time for your soft tissue to absorb the laser energy. Here on this screen, on this slide, you can see two different cuts. On the left side, the dentist move slowly on the tissue, so it gives enough time for the tissue to absorb the laser energy. So you can see your cut is deep, and it has a better incision, and also it is well defined. If we speak about the cut on the right side, the dentist move very fast, so you can see that the cut is superficial, and it is not it's not very deep. So the slower you move, the better the absorption, and also the better your cut is going to be. So don't work very fast at all. Try to work as slowly as you can to give enough time for your tissue to absorb the energy. I just want to confirm if you can hear my voice or no, because I think some dentists they don't hear my voice. Could you please confirm if my voice is clear for you or no? Okay, thank you. So as we spoke already, the slower you work, the better the absorption effect that you are going to have. So when when your patient come to your clinic, you can try to make a very small test on his gingiva. Try to use a very low power, for example, 1 watt, and test 1 watt on the gingiva. If you can see that your cut is very clear, and there is no carbonization and no smoke, that means that your energy is good. But if you once you touch the gingiva and you smell the smoke and you find your cut is very dark, that means that you are using a very high power, and you need to decrease the power. Then we go to the fourth point, which called the operation mode. Dental laser have different operation modes. First one is called the continuous wave, gated mode, and pulsed mode. So the continuous wave means that the laser comes out from the handpiece continuously, such as the water when it comes from your bathtub. So it is a continuous stream. There is no interruption at all. The advantage of this laser, of this mode, is it has a very high cutting power, and it is very fast to cut. But it has one problem, that it has very high temperature when you cut the tissue. So if the dentist is not professional enough, or he has not skill, sometimes when he uses the continuous wave, he may do some damage to the tissue. Then we go to the gated mode. The gated mode is similar to the continuous wave, except that we have a gate which is added in front of the laser source. When this gate open, the laser is going to pass, and when the gate close, the laser is going to stop. The advantage of this mode is the laser, you can use the advantage of the continuous mode, and also you can avoid burning the tissue, because when the gate closes, the laser is not going to pass, and then your soft tissue is going to cool down. Then we go to the pulsed mode. The pulsed mode is somehow similar to the gated mode, but except in the pulsed mode, we don't have a gate, but the laser itself, the laser beam itself is coming out into pulses. So the device is going to give you one pulse, and then it will stop, and then another pulse, and then it will stop, and so on. Between the two pulses, the laser will be very, very minimum. You will have a very low between the two pulses, so this will give you enough time for the tissue to cool down. And it also allow you to use high power, such as like 50 or 20 watt, for example. This power is very high. So with the pulsed mode, you can reach a very high power, and you can decrease um, the damage to the tissue, because between the two pulses, the laser, there will be no laser, or the laser will be minimum. So this will give enough time for your tissue to cool down. So just I want to clarify one point. At the end, the laser is an energy. Once the laser is absorbed by your tissue, it will produce energy, and this energy is going to produce heat. It is going to increase the temperature of your tissue. So when the dentist is working, you have to give enough time for your tissue to cool down, because when the temperature is increased very high, you will have a risk to burn the tissue. Here's a small comparison between the continuous mode and the pulsed wave. So as you can see on the left side, with the continuous mode, you have a very amount of energy absorbed by your soft tissue. That means you have higher thermal increase and thermal damage to the tissue. But with the pulsed mode, you have less energy absorbed, and at the end, less thermal damage. All of the dental laser devices, all of them, they have two modes which you can choose when you do the application. You can choose either the continuous mode or the pulsed mode. Both of them are good, but except the continuous mode, it cuts more because it is much more stronger. So the dentist have to be very careful. And with the pulsed mode, it has a less cutting efficiency, but it has a better thermal control of your tissue. So it depends on what you want to do. If you want to cut more, you have to have better skill, and then you can use the continuous. If you want to be on the safe side, then you can use the pulsed wave mode. Finally, we go to the fifth point, and it's called the distance between the laser handpiece and the tissue. Some application you need to touch the tissue, and other application you don't need to touch the tissue at all. What is the mean to touch the tissue? You have to be slightly touching the tissue without pressure at all. You just stay on the surface. Don't do any pressure. Don't push your handpiece onto the tissue. Just stay slightly touching the tissue. And the application in which you don't need to touch, you have to be around from 5 to maximum 20 millimeter away from the tissue. We will speak later about which application I need to touch and which application and I don't need to touch. Then we go to the anesthesia. Which kind of anesthesia I have to use when I use dental laser? If you are going to use the diode and the Nd:YAG, in that part you need to use a plain anesthesia without vasoconstrictor at all, because diode laser and Nd:YAG lasers, they mainly depend on the hemoglobin. So if you inject an anesthesia which contain epinephrine or adrenaline or a vasoconstrictor, that means you are going to decrease the amount of the hemoglobin on the tissue, and finally when the hemoglobin level is decreased, your cutting efficiency also will decrease. So the best type of anesthesia to use is the plain anesthesia without vasoconstrictor, without epinephrine, without adrenaline at all. You can use it topically or a gel or a spray. Most of the application, you don't need to inject anesthesia at all when you use laser. So only small drops or gel will be enough for the treatment. Then we go to something called the low-level laser therapy. And the low-level laser therapy, it means that we use a very, very low amount of power when we apply it on the soft tissue. This power is not enough to cut at all, but it is good only to improve the healing process of the patient. So what kind of what happened inside the patient mouth when we use the low-level laser therapy? For example, let's say that you have a patient who made a flap and you need to improve the healing for that. You can apply the laser after you close your flap to improve the healing. You can also use the laser if you have a patient who complained from a TMJ problem to decrease the pain which the patient complained. For example, if he has a clicking and he has pain, you can only treat the symptoms. You can treat the pain, but you will not treat the clicking. So first you have to know the reason of the clicking, and then you can use the laser to decrease the pain. What is the mechanism of the low-level laser therapy? Inside our body, we have a mitochondria cells, and the mitochondria cells, they are responsible to produce ATP and also produce nutrition for the other cells. Inside the mitochondria, we have something called the nitric oxide. The nitric oxide level, sometimes it is affected, it is sometimes increased or decreased. At any way, when the nitric oxide level is changed above or below the normal, the mitochondria will not be able to produce enough nutrition and enough energy for the other cells. So that means that your cells will not be able to heal very fast. When we apply the low-level laser therapy, the mitochondria is going to absorb the laser energy, and the laser energy is going to break down the nitric oxide, and then the mitochondria activity is going back to normal, and it will be producing ATP, nutrition, and energy to the other cells. And then the fibroblast is going to be, the activity of the fibroblast is going to increase, and then you will be able to treat the patient who complained from pain, and also it will improve the healing process because the fibroblast is mainly responsible for the regeneration. So this is simply the mechanism behind the low-level laser therapy. What exactly happened in the tissue simply is mitochondria absorb the laser energy, nitric oxide is going to be is going to be back to the normal level, then fibroblast and the collagen will be increase the activity of the fibroblast and the collagen, which means in result the healing process will be much more faster. Then we will speak about the different type of of laser devices in the market. There are two types of laser devices in the market. There are devices which called the open mode devices, and we have another devices which called the preset devices. The open mode, you can control the power, the frequency, and the pulse duration. But with the preset mode devices, it means the device will come from the factory with a preset application in which you cannot control at all. The advantage of the open mode devices, it gives you more flexibility, especially for the laser specialists who are using laser every day. But with the preset mode, it has an advantage because it is very easy to use and also very fast. and it is very suitable for the dentist who want to work very fast without, the hassle to set the moods and set the power frequency. So the preset mood are very suitable for this kind of dentist. The disadvantage of the open mode is the dentists have to be specialized in the laser. He need to know more about the laser knowledge so he can control the parameters correctly. But with the preset mode, it is easier for the dentist because all of the application are already preset from the supplier. So you don't need to control the power, frequency, all of them are already preset. So it depends on which kind of on what you want to do. If you are a laser specialist and you need more flexibility and more application, then you can use the open mode devices. If you want to work very fast, you don't want to set the parameters, then I suggest you to use a preset devices. Then I will go fast in this part. If you remember in the first slide, we spoke about the laser devices, that it consists of two main components, which are the production unit and the delivery system. So there is a lot of delivery systems in the market. You have the articulated arm, waveguide, and optical fibers. Here is an example of an articulated arm. If you see these kind of devices in the market, mainly this device is going to be a hard tissue laser, because the hard tissue lasers, they produce a very high amount of energy, and they need to use this kind of handpiece to deliver the high energy. Then there is something called the hollow waveguide. This is also hard tissue laser. So if you see any device in the market with this kind of design, mainly, or let's say 90%, this device is going to be a hard tissue laser. Then we go to the handheld units. These units, I personally don't recommend them at all because they are very weak, and also they get damaged very fast. So the laser maximum can last up to 1 year or 2 years maximum. So this laser is not enough to do all of the applications such as gingivectomy, bleaching, depigmentation of the gingiva. This laser cannot do it at all because it is not strong. Usually it can be used only for the retouching. So for example, if you have something very small or some small application, you can use this device. But if you want to do a major surgery or a major application, this device will not be good for that. Then finally, we go to the optical fibers. And this is how the optical fiber looks like. It is very flexible. It allows to deliver the energy from the laser production unit up to the patient mouth very easy. Also, it gives you a wide range of sizes from 200 and up to 1000 micrometer. Then we go to the initiation of the fiber. All of the fibers which comes with your device will be in non-initiated mode. Non-initiated mode, it means it is not going to cut. So let's make it very simple. There are two types of fiber. First one is initiated fiber and non-initiated fibers. So non-initiated fibers, it is not going to cut, but it will only disinfect the bacteria and coagulate the blood. And the initiated fiber is going to cut. So this is very simple. When you have your fiber initiated, you will cut the soft tissue. And when you have your fiber non-initiated, that means you are going only to disinfect and kill the bacteria and stop the bleeding. How we can initiate the fiber? Simply, you can use the eye mascara or something very dark to initiate the fiber. So you will apply the laser on these dark surfaces, such as the mascara or something very dark. I don't recommend to use the articulating paper, because articulating paper, they are not dark. They are simply more blue. So try to use something very dark in color, something black, because the darker the surface, the better the initiation you are going to do. You will apply your laser from like 2 or 3 seconds interruptly onto the dark surface until the end of your fiber is being black. That means your fiber has been initiated. Then we go to the correct cutting of the fiber. Usually after treating the patient, you need to cut your fiber. Try to make the cutting to be 90-degree angled, because if the laser is, if the fiber is not cut correctly, that means that the laser beam is going to be out interruptly. So in this picture, you can see here is the correct cut. You have a 90-degree angle. And in this picture, you have a wrong cutting of the fiber, which means it has around 45 angle cut or beveled. So with this, if you see this picture, that means you have wrongly cut the fiber, so the laser beam is not going to be out correctly. How can I know if I already cut the fiber correctly? You have to see this beam. You will bring a black paper and you apply the laser on it to see if you have a uniform circle or a uniform circular beam. That means your cut is correct. But if you see this picture in front of you, that means your laser is not, your fiber is not cut correctly. So you need to recut your fiber. So try to make sure that you have correctly cut your fibers so you can deliver the energy required for the treatment. Then we go to different types of fibers in the market. First, we have the single-use optical fibers. These fibers are mainly used by BioLaser and Dr. Smile. They are company in dental laser. These fibers are disposable. They can be used only for one time, and then they should be thrown away. Some dentists try to disinfect them or autoclave them, but they are not designed to be autoclaved. So if you autoclave them, they will be damaged. So simply you have to use it only for one time. The advantage of these fibers, they have a less risk of cross infection. So you have a very you will make sure that you are not going to transmit any infection to the patient. But it has a problem that they are expensive. They are very expensive when you purchase them, because only one fiber is enough for only one case. So every treatment you need to buy fibers for your device. Then we go for the autoclavable fibers, which we use as Alexian company. We use these kind of fibers. These fibers are autoclavable. You don't need to cut them at all, because they are designed by the manufacturer to be decreased. So all of the other fibers, you need to cut them after each treatment, but Alexian fibers, you don't need to cut them at all. The fiber size will decrease by the time. Each fiber can be used up to 45 patients, and with each device, you are going to receive a kit of 9 fibers. So that means if you buy the Alexian laser, you will be able to make 405 patients for each kit, because one kit will come with 9 fibers and each fiber can last up to 45 patients. So in total, you can treat up to 400 cases with Alexion fibers. So you will save a lot of money with this fiber kit. Most of our dentists who buy Alexion laser, they will not buy a fiber kit until 1 year. So this is the average of our dentists. We can say if you are a heavy user of laser, you will need to buy the kit after from 6 to 8 months. And if you are not a heavy user, sometimes you don't need to buy the kit after 1 year. I received a question about how long do we need to initiate in a dark paper. Usually maximum up to 5 seconds. So, but not continuously. You have to do it like interruptly. Like you touch the dark surface and you move and touch and move and so on. Don't do it continuously because if you do it continuously, you are going to burn your fiber. So bring a mascara, eye mascara, which is used by the ladies. This is scientifically proven to be the best initiating medium, and then apply your laser up to 5 seconds maximum on the dark surface until the end of the fiber is being dark. Then we go to the optical fiber wire. There are some companies in the market which is using these kind of fibers. Actually, the problem for this fiber is you cannot disinfect them, you cannot autoclave them, so you also have a high risk of infection to give to the patient. Another part, this laser doesn't, sorry, these fibers doesn't give you a lot of sizes. So with electron fibers, we have a lot of diameter. We have 200, 300, 400, and 600 fiber sizes, but with this kind of optical fiber wires, usually you are very limited to the diameter of the fiber. Another point is you don't deliver a full energy from the production unit up to the patient mouth because these fibers doesn't have the ability to carry out the energy correctly to the patient mouth. It has only an advantage. It is very cheap in the price, but as I mentioned, they cannot be sterilized. They always need to be cut, and also they are limited in the size. Finally, we go to the glass rod, and the glass rod is usually used for the low-level laser therapy. The glass rod, you can use it to do the bleaching. You can use it for low-level laser therapy, and also you can use it to disinfect and kill the bacteria inside the oral cavity. Just I want to add the small points regarding the diameters of the fibers. The smaller the diameter, the better the cutting efficiency, because the laser will be more concentrated. So, for example, if you have your X-ray at your clinic, the X-ray with a focal spot 0.4 is better than the X-ray with a focal spot 0.7 or 0.8, because the smaller the diameter, or the smaller the focal spot, means the laser beam will be more concentrated, so it will cut more. So the 200 micrometer fiber will have a better cutting efficiency compared to the 600 micrometer fiber. Then we will go to the election devices. We have something called the DPL technology, or the digital pulsed laser. Simply, what does that mean? It means that we are using an LED lamp inside our devices to initiate the laser. So if you compare the LED lamp and the halogen lamp, they turn on very slow, and they also turn off very slow. But with the LED lamp, they turn on very fast, and they reach the maximum power once they receive the power, and once you switch them off, they will simply turn off, and there will be no laser at all. So this is simply the explanation of the DPL technology. So that's why we don't burn the tissues of the patient. This is a picture of during the treatment. You can see there is no carbonization at all. There is no dark or black color when we cut, because with the DPL technology, we can reach a very high amount of power very fast, and we give them into different pulses. So we give a very high amount of energy into different pulses very fast, so we don't give enough time for the tissue to burn. Here is also another picture regarding the DPL technology. You can see there is no dark color at all. There is no carbonization because we deliver a very high amount of energy on a very, very short pulses and very fast. So we don't give enough time for the tissue to burn, because the tissue gets the laser into very, very short pulses with very high amount of power. And between the pulses, there will be no laser at all. So this will give enough time for the tissue to cool down. There is a question about the difference between the fiber rod and the fiber tip. Actually, there is no big difference between both of them, except in the low level, in the glass rod. The glass rod will deliver less amount of energy compared to the fiber tip. So the fiber tip is mainly focused. It is mainly concentrated. So the fiber tip can cut the tissue, but the glass rod cannot cut the tissue because the laser energy is being exposed on the surface, not concentrated. So that's the difference between both of them. So with the fiber tip, you will cut the tissue, but with the fiber rod, you will only make biostimulation. With the glass rod in the low-level laser therapy, yes, you can decrease the pain from the trigeminal neuralgia, because it has the same mechanism. With the low-level laser therapy, usually we target the mitochondria and we target the fibroblast, because both mitochondria and fibroblasts responsible for the healing. And when they absorb the low-level laser therapy, the low-level laser energy, they are going to decrease the pain in the trigeminal neuralgia. Here is another picture of the low carbonization on the soft tissue because of the DPL technology which we use in Alexion. On this video, you can see the cutting during here is the energy during using Alexion laser. You can see there is no carbonization at all. The patient is not feeling any pain, and also you can see the definition of the cut. Your cut is well defined. You can simply see the walls of the cut. There is no carbonization, no dark surface at all. Because we deliver high amount of energy on a very, very short pulses. And these short pulses give enough time for the tissue to cool down. Here is another video also to show you the advantage of the DPL technology. So with Alexion laser, we have a very low amount of carbonization at all. So the carbonization is almost to a minimum. Okay, regarding the water spray to cool the wound during the surgery, you have two options. If you are using the diode laser, you can use the water spray, but not continuously. You have to apply small drops of water, and then first you stop the laser, and then you apply water spray, and then you work with the laser again. Because if you work together at the same time, the laser together with the water, diode laser, they have less absorption into the water, so the water will will act as a barrier between your soft tissue and between the laser, so it will decrease the absorption of the laser into the soft tissue. So that means your cutting efficiency will be decreased. But if you are going to use a hard tissue laser, it's not a problem to use the water at the same time, because hard tissue lasers, they love and they like the water. But with diode laser, don't use it at the same time. So you can use the laser and stop, and then apply few drops of water, and then start the diode laser again. Regarding how we can protect the surgical smoke, um, we will speak about that in the laser safety in the next slide. How you can protect yourself from the laser smoke, and how you can protect yourself from the hazards which are coming out from the laser. Then here is Alexion devices. Mainly we have three types of dental laser. We have the Claros, it comes Claros Pico, it has 5 watt. We have a Claros Nano 15 watt, and we have a Claros 50 watt. All of our devices, they can do the same application, they can do the same process, except that every device, it gives you more features and more flexibility. So if we are going to speak about the Pico 5 watt, this device comes with 7 programs. These 7 programs can allow the dentist to make 36 dental applications. So you can make depigmentation, you can make soft tissue surgery, you can make um, gum depigmentation, lip depigmentation, you can also do frenectomy, gingivectomy. So the Pico also can make low-level laser therapy, and also it can make bleaching of the teeth. So the Pico gives you a lot of application, but this device is a preset device, so you cannot control the power or the frequency. The device comes with 7 programs already preset. So it is very easy to use. The dentist only need to click and start the application. Then we go to the Nano. Nano is mainly more advanced. So the Nano comes with 30. So with the Nano, it comes with 36 preset application inside the device. Plus, you can also have the free mode in which you can control the power and the frequency. The device comes with 15 watt of power, so it gives you more flexibility for the laser specialist who want to work and modify the parameters. Finally, we go to the Claros 50 watts. This is our big device. The Claros 50, actually, it is a very, very advanced device. It comes with 70 dental application on the screen. The good feature of this device that it can guide the dentist how to make the treatment. So for example, if you want to make a gingivectomy, the device is going to tell you which size of the fiber you have to use. For example, 200, 300, or 400, it depends. And it is also going to tell you how long is the treatment time. And in case you are you work for longer time, the device is going to shut down to prevent any damage to the patient. With the Claros, you can control the frequency, you can control the power, you can control the pulse duration, and also you can control the time between the pulses. So this device is very good for the dentist who want to make some research about laser. The device is available at the University of Genoa Research Center. There is a question about how can we reduce or control the inflammation after gingivectomy. Actually, when you make gingivectomy using the laser, I can recommend that you can use a Genji gel, intravitreal gel or periodontal dressing, which contains some mint and an anti-inflammatory drug. So usually after the laser, you will not have inflammation because during the application of the laser, you will kill the bacteria in the field. So most of the time, you will not have any inflammation. But just to make sure that the patient will be fully healed, you can apply any periodontal dressing which contains some mint just to cool down the soft tissue after the treatment. Then we have another product. It's called the Periogreen. Um, sorry. Yeah. Then we have some another product. It's called the Periogreen. So the Periogreen, it has an active material. It's called isocyanide green. This material actually, when you apply it on the infected site or the infected gingiva, it will make an attachment with the protein membrane of the bacteria. So every bacteria and every viruses, they have a protein membrane or a protein wall around around it. So the protein membrane is responsible to protect the bacteria and keep it alive. The Periogreen, when you apply it on the patient, the Periogreen, when you apply it on the infected side, it will make an attachment. It will make a connection between with the protein membrane of the bacteria. And after you apply the laser is going to activate the Periogreen material, and then it will break the protein membrane, and then the bacteria is going to die. So this is simply how the Periogreen is done. So you can apply the Periogreen on the gingiva. You can apply it in the infected periodontal pocket. You can also apply it inside the root canal. So this material is very good to disinfect and kill the bacteria together with the laser. Here is how the devices are being delivered. So all of our devices, all of them, they have a medical foot switch. All of them, they have the same accessories, same fibers, same glasses. So for example, if you buy the Nano and later you need to upgrade your device to a Clarus, we can simply take back the Nano from you and give you the Clarus, and you can only pay a small amount of money to upgrade your device. You don't need to change the fiber. You don't need to change the handpiece or the foot switch or the accessories, because all of our devices, they have the same fibers. We also have a buyback plan. So for example, if you buy the Pico and later you need to upgrade to a Nano, no problem at all. We can take back the Pico from you, and we can give you the Nano, and you can only pay the money for the device. There is a question about the Clarus. The machine is going to give you like, we are not going to give a picture or a photo, um, but the device itself, it will give you a recommendation like how long is the treatment time. So for example, let's say depigmentation. Usually the depigmentation doesn't need more than 2 minutes in total to do it. So if you choose depigmentation program, the device will be set to turn to stop after 2 minutes. But you have also the option to use it in the free mode. So this is how the devices only give you a recommendation for each treatment, how long does it need, and also which kind of fiber size you have to use. Then here is the Pico. It comes in a suitcase. So It is similar to the Nano and also to the Claros. As I mentioned, all of our devices, they have the same accessories, same foot switch, same fibers, and same handpiece. All of the devices comes with a kit of 9 fibers. Each kit can last up to 400 cases. And as I mentioned before, also, we can upgrade your device later. If you buy a Pico and you want to upgrade to a Nano, we can do that. Or if you buy a Pico and you want to upgrade to a Claros, we can also do that. And finally, we go to something called the Snort 3. So the Snort 3 is an application which comes only in the Claros 50 watt. So the main difference between our devices is only the Claros 50 watt can treat the patient who complain from snoring. The device is available in the research center of University of Genoa, Italy. This device actually can treat the patient who complain from snoring within a maximum up to 5 treatment. So, or up to 5 session. Usually the patient needs 3 session, up to 5 session. It depends on each patient. Watch one session, it should take around 25 minutes, and then the patient is going to leave, and then the patient will come back again to the dentist after 6 weeks and to take the second session, and then again will come after 6 weeks to take the third session, and so on. So usually the protocol is the patient will need at least 3 sessions and maximum up to 5 or 6 sessions. Between each session, the patient need to take around 6 weeks to come to the dentist again, because it depends. In this treatment, we usually target the collagen, and the collagen to be completely produced in our body, it needs around 6 weeks to be completely produced. Now we are going to speak about the laser safety. I will go it very fast. So there are different different classes of laser. So first we have the class 1 laser, in which you can see it in your car, in your CD reader, in your PlayStation. All of these kind of devices, they are class 1. There is no problem at all to see them with your eyes. You don't need to wear any glasses or something, because this laser is very weak. It's not strong enough to do any damage. Then we go to the class 2 laser. They are also very weak laser. You only need to wear a normal plastic glasses if you are going to look directly to the beam of a class 2 laser. So only a regular plastic glasses is enough to protect your eye. Then we go to the class 3, and the class 3 laser is the laser that you can see in the festivals or in the Happy New Year shows. This laser is also this laser is dangerous in case you are going to look directly into the beam. So that's why you can see the laser source in this kind of parties. The laser source is very far away from the audience. So you can see that the audiences and the people are staying in certain area which is very far from the laser source, because this laser can do some burn if it touch your body. So as long as you are very far from it and it is not touching your body, you will be in the safe side. Then finally we go to the class 4 lasers. Class 4 lasers which are mainly class 4 laser which are mainly absorbed by the hemoglobin, melanin, hydroxyapatite, or protein. So with the class 4, you have to be careful and protect yourself, protect the assistant, and also protect the patient from these kind of lasers. So you must wear the glasses at all of the time. So how we can protect our eyes? Usually there are certain protective eyeglasses for designed especially for the laser. The most important points to know about the protective glasses is every protective glasses, they have 3 marks on them. The first one is called the wavelength range. So this will tell you which kind of wavelengths these glasses is going to protect your eyes from. And then the second mark, it's called the operation mode. It will tell you which kind of mode you can use these glasses for, like continuous mode or pulsed mode or both. And finally, you have the mark for the protection level. So this will tell you about the filter of your glasses is totally covered. So the whole glasses is covered or only part of the glasses is covered by the filter. It is always advised to use a full coverage glasses. There is a question about which wavelengths is needed to activate the photosensitizer. It depends on the product itself. So there are some photosensitizer that need to be activated by the 810 wavelengths. There are some need to be activated by the 980. So it depends on each photosensitizer. For example, for Alexion, it is activated by 810 for the perigrin. And also it can be activated by 980. Both of them will work. But when you buy any photosensitizer, you need to read the recommendation about which wavelength is suitable for that. Then we go to the laser smoke or the laser blooms, which we received a question about it. So every laser is going to produce something called the laser bloom or the laser smoke. This bloom, sorry, this bloom is sometimes it contains some bacteria, sometimes it contains part of the protein which comes out from the viruses. So to protect yourself from it, you have to wear a special designed laser mask. So there are a lot of companies which produce a special laser mask to protect yourself from the laser blooms. Usually, most of the laser which produce blooms are mainly the CO2 lasers. They produce a high amount of blooms. But if we are speaking about the diode laser or the dental laser, the blooms which are coming out from them are very minimum. They are not a lot. So but anyway, you have to wear a special laser designed mask to protect yourself from the laser blooms. On this picture, it shows you which kind of laser is producing the blooms and which kind of part of our body is going to be affected by these blooms. Here is a picture of the laser designed protective mask. Usually these masks are similar to the coronavirus mask. So they have a filter of 0.5 micrometer to prevent the proteins which are coming out from the bacteria or the viruses. So this is how the mask is designed, and these are the marks which you will find on your mask. So it will tell you which kind of filtration filter it's going to protect yourself from, and so on. So anyway, when you buy the mask, I can say that the surgical mask is they are enough. If you cannot find a laser designed mask, then the surgical mask will be enough to protect yourself from the laser blooms. Also, especially since we are in the COVID pandemic, so there have been a lot of research which have proven if you use the iodine to apply small drops of iodine on the gingiva and also on the lips when you are using the laser, this will decrease the progression and decrease the activity of the coronavirus. So before you start your application, you can bring some iodine and you apply small drops to cover the gingiva and the lips of the patient, and then you can start your treatment. This will give you more protection level against the coronavirus inside the patient mouth. Finally, you can also use the HEPA filter or the extraoral suction. All of these filters, they will also protect you from the laser blooms and also protect you from the viruses and the smoke which is coming out from the laser. Regarding the laser safety, also, it is always recommended to use a plastic instrument or a wooden instrument because they will not reflect the laser beam to your eyes. So, for example, if you are using a diode and um, you have to use an instrument with it, try as you can to use an instrument um which will not reflect the laser energy or the laser toward the patient mouth. So if you cannot find any plastic instruments, so it's okay. You can use the metal instruments, but try to be away from the laser beam to prevent any unnecessary reflection to your eyes. Here are the applications that you can do with our devices, the Pico Nano and the Clarus. With the general surgery, you have around 16 applications. With the implant, you have around 3. You can also support the peri-implantitis treatment. You can also do endodontic treatment. So we have more than 70 dental applications that you can do with all of our devices. Now we are going to go shortly with the clinical application. So you can use our devices to disinfect the root canal, but there is one important point about disinfecting the root canal. When you use the dye, the canal has to be totally dry, because if the canal is wet, the water is going to prevent the absorption of the dyed laser, and then it will decrease the disinfection process. So try to make sure that your canal is dry before you apply the laser. Then we go to the laser bleaching. Laser bleaching actually depends mainly on the bleaching gel. Make sure to use a red bleaching gel, or if you cannot find the red one, you can use a green or a blue one, because the white bleaching gel is not suitable for bleaching, because it doesn't have the capacity to absorb the dyed energy. So the best bleaching material will be the red one. If you cannot find the red, I can recommend to use the green or the blue, because they have the capacity to absorb the dyed energy. How you can make the treatment? You will bring your gel, you will apply it on the tooth, and you can leave it for 10 minutes. After the 10 minutes pass, you will bring your handpiece and you will apply the laser on the gel, 30 seconds if the tooth is vital, and 60 seconds if the tooth is non-vital. And then you will wash away the gel. Usually, you will have around at least 2 shades and up to 4 shades change for the patient. Here is another case of laser bleaching. You can see it is the picture before is A3, and here is after the treatment, it is A1. So we got 2 shades change. The good advantage of laser bleaching is you will have a very, very low sensitivity for the tooth. So if you compare the laser bleaching with other bleaching devices such as Zoom, Beyond, or Flash, usually the normal bleaching can cause hypersensitivity to the patient. But with the dyed laser, you will have very, very less amount of sensitivity for the patient. So that usually most of the patient, they don't complain from sensitivity at all after the treatment. Then we go to the application in pedodontics. You can all of these applications have been done with the Pico, by the way. So all of the application that you see and the picture that you see on the screen, most of them were done with Alexion Pico. So here you can expose the unerupted teeth. You don't need to use any anesthesia. Only topical anesthesia will be enough. No need to do any injection. The power usually doesn't exceed 3 watts. Here is the picture before, during the treatment, and immediately after the treatment, and finally after 8 days of the treatment. Here is another case of labial frenectomy. This is the picture before the treatment, and this is the picture during the treatment. You can see there's no carbonization at all, and here is the final result after 6 days. Another case of labial frenectomy. Here is the picture before. Here is the picture after. In this application, usually we can use the fiber size 300 and 400. They are very suitable for this kind of application. You don't need to use any injection of anesthesia. You can only apply gel or spray. You don't need to do any suture or stitches. And the most important point when you cut the frenum, make sure that you cut it totally from the base and until the free gingiva, because if you leave any part of the frenum, you will have a relapse and a regrowth from that part. So make sure that you have cut the whole frenum from the base and until the free gingiva. Here is also another case of that. You can see there is no carbonization at all with Alexion laser. There is no red, there is no black color in the cut, and the healing process is very, very fast. Another case for the lingual frenectomy or the tongue tie. Here is the case immediately at the same time after the frenum was cut. Also another case for frenectomy. Here is the picture before, and here is the picture immediately after the treatment. Then we go to the application for the orthodontist. So the advantage of using the laser by the orthodontist is most of the orthodontists, if they want to expose an uninterrupted tooth, usually they will ask the patient to go to the oral surgeon and then expose the uninterrupted teeth and later come back again to the orthodontist. So if the orthodontist is having a laser at his clinic, he can have the ability to cut and expose the uninterrupted tooth and attach the bracket at the same session, because you don't have bleeding at all. So you will have the ability to attach your brackets and make the cementation without any problem. So for the orthodontist, it is very, very beneficial and important to have a laser device in your clinic, because it will save a lot of time for you to attach the brackets at the same session. And also right now, there is a lot of researches about the low-level laser therapy for the orthodontists, that they are using low-level laser therapy and biomodulation to control the movement of the tooth, to improve the speed of the movement of the tooth. So there is a lot of new applications by the laser which are very beneficial for the orthodontist. After I finish, I will send you some research about these applications. Here is also another case of exposing unerupted tooth. Here is the picture before, and here is the picture after. Another case of exposing the unerupted teeth. Here is the picture before, during the treatment, and immediately after attaching the brackets. You can see that there is no bleeding at all, so you have the ability to attach and cement your brackets at the same session. Then we go to the recontouring of the gingiva. Recontouring of the gingiva, you can use a fiber size 300 or 400 will be enough for this application. Here is the picture before the treatment, and immediately during the treatment, there is no carbonization, no smoke, no black color. And here is the picture 3 days after, 15 days, and finally after 1 month. Of course, in this treatment, the fiber is being initiated because you want to cut. So initiated fiber is going to cut the tissue, and non-initiated fiber is going only to disinfect the tissue. Here is another case. In this case, actually, we did, there are 3 applications: crown lengthening, laser bleaching, and depigmentation of the gingiva. All of them was done with Alexium Pico. So here is the picture on the on the left side and on the right side. You can see the difference. And this case was done, this is the final result after 8 days of the treatment. You can also remove the fibroma. The fiber size will be 300 and 400. These are only a recommendation about the fibers size. So you have the option to use any kind of fiber you want to use, but this is just a recommendation. Also for the power, usually don't exceed 3 watts. So 3 watt is the maximum power to use. For me, as I mentioned, I only use maximum 1.8. But for example, some dentists, they want to increase the power to work faster. So it depends on your choice. You can increase the power and work fast, and you can decrease the power and work less. So it depends on what you want to do. Here is the frenum after it has been cut from the tissue. And this is the final healing result after 6 days. Usually you don't need to give any antibiotic to the patient or anything. There will be no swelling. There will be no inflammation after the treatment at all. Only the patient will feel like a small feeling of discomfort, which will be vanished within like 4 hours after the treatment. And then the patient will not feel anything. Here is another case to remove the fibrosis from floor of the mouth, sorry, from the ridge, especially for the elder patient. Here is the picture immediately after the treatment was done, and here is the final result after 10 days. Then we go to the lingual frenum again. Usually the frenum should be removed from the children when they are young, but in some cases, some adults, they will not remove it. So this case, the patient age was above 25 years old, and here is the treatment after the frenum was cut. Usually in this treatment, we had to do stitching because the cut was very big. So we need to do stitching to make sure there will be no infection after the treatment. Here is also another case of frenectomy. This is the case which was done for a patient to make a gingival contouring. It was also done by the Pico. You can also remove the stones from the salivary glands. Here is the picture before the stone was inside. Here is a picture after the stone was removed. And here is a video of the treatment. Then we go to the implant. You can also use the laser to expose the dental implants. Here is the picture before the exposure, and here is a picture after the exposure. The good advantage of using the laser to expose the implant is you only make a very small cut around the implant, which is smaller than the diameter of the healing abutment or the gingival former. So you don't need to make a horizontal cut and make stitching and sutures. You only make a very, very small amount, a very small cut which is smaller than the diameter of the healing abutment, and then you can attach your healing abutment or gingival former easily. The advantage of that is the laser itself will help the healing abutment to make the formation of the gingiva very fast. Another case of exposing the implant. Here is the picture before, during the exposure, and finally after the exposure. Also, you have an advantage is the laser can kill the bacteria and disinfect the implant surface. So in case you have in case you have a patient who come with peri-implantitis, or even without peri-implantitis, when you expose the implant with the laser, you will kill the bacteria and disinfect the application area. So this also will give you a better healing uh, effect and also a better prognosis of your case. Here is another case of recontouring and depigmentation of the gingiva. This is before, during the treatment, and finally the final result within 6 days. Then we go to the depigmentation. Here is with the depigmentation, it is recommended to use a fiber 400 or 600 size. Here is if the gingiva is very dark, you decrease the power because the absorption is high, and if the gingiva is not very dark, in that part you need to increase the power. Here is the final result within 6 days. Another case of depigmentation of the gingiva. Here is the picture before, and here is the picture after 6 days. This case was done with Alexion Pico, by the way. Another case of depigmentation. Here is before, during the treatment, and finally after the treatment. Then So I will skip the depigmentation cases because we have a lot of depigmentation cases here. All of these pictures are for depigmentation before and after. I will go to the low-level laser therapy applications. Yeah, here is another application for the depigmentation of the lips. You can also do it with Alexium Pico. So, but this treatment is very sensitive and it requires some skills. So I recommend, if you want to do this application, to know more about the laser physics and the tissue interaction, just to avoid making any damage to the patient. So here is the picture before, and here is the picture after the lips were depigmented. Then we go to the low-level laser therapy. You can also cut the frenum with the scalpel, and you can use the laser to stop the bleeding. So you have both options. You can cut the frenum with the laser, or you can cut the frenum with the scalpel, and then use the laser to stop the bleeding. Also, you can use the low-level laser therapy to stop the bleeding from the socket. If, for example, after the extraction. Here is the picture after the bleeding was stopped. You can also use the low-level laser therapy after the flap surgery to improve and make the healing process become fast or faster. Also, you can use it after the frenectomy to improve the healing and decrease the pain for the patient. Also, for the abscess ulcer, here is the picture before, during the treatment, and here is the final healing after 2 days. So the treatment, usually you will apply the low-level laser therapy on the abscess ulcer for 5 minutes continuously. The patient must feel a change in the temperature of his tissue. So he should not feel any pain, but he should feel something like a little bit hot on the tissue. So the patient should feel the heat of the laser, but this heat should not be painful for him. Here is also another case for abscess ulcer. Okay, there is a question about how many visits for low-level laser therapy. It depends. For the abscess ulcer, you can do it only in a single visit. Most of the abscess ulcer, it need only one visit. You will apply the low-level laser therapy on the abscess ulcer for 5 minutes continuously, and then the patient will not feel any pain. And within 2 days or 3 days, the abscess ulcer will be healed completely. But for example, if you have a patient who complained from pain because of the TMJ, these cases actually, the patient will need around 8 sessions. So the patient will come to me one day, and then he will take one session. You will divide your TMJ into 5 or 6 points. Each point, you will apply the laser for 2 minutes continuously, and then the patient will leave, and he will come to you again after 1 day. So 1 day yes, and another day no, and then after day yes, and so on. The patient usually need 8 sessions. Within the 5 session, he will feel that the pain has been gone. That's regarding the pain from the neuralgia and the pain from the TMJ. But for the abscess ulcer, you can do it only in a single visit, and to stop the bleeding after extraction, you can also do it in a single visit. Here is another case for gingival troughing and retraction of the gingiva. You can also retract the gingiva with the laser, so you can take your impression. instead of using the retraction cord. You can also use it with the CAT cam and intraoral scanners to stop the bleeding so you can take your impression correctly. Here is another case after for low-level laser therapy to treat the herpes. Here is the picture before, after the treatment, and you can also treat the patient who complain from hemangioma. Also, you can treat it with the laser. Yes, you can use the low-level laser therapy in major abscess ulcer. It is the best choice for that. Each ulcer will take 5 minutes of laser application. So you will use the laser on 0.8 or 1 watt, and you will apply it for 5 minutes continuously on the abscess ulcer. And after that, the patient will not feel any pain for the ulcer. Then we go to the final slide of today's presentation. I'm sorry it was a little bit long, but I tried to cover as much as I can. So as we spoke before, we can treat the patient who complain from snoring. So usually we treat the patient who complain from snoring because they have a problem in their soft palate. Usually snoring has a lot of reasons. Some patients snore because they have a problem in their vocal cords. Other patients snore because they have some problems in their sinuses. Some because of the soft palate. So in Alexion, we can only treat the patient who complain from snoring because they have a problem in their soft palate. How we can do that? Usually the soft palate, because of the age, because of the patient is smoking or drinking alcohol, and also because of the gravity. Some patients who are exposed to high gravity, they will have a problem in their soft palate, especially the cabin crew and the pilots who travel a lot. Most of these people, they have problems, they have snoring problems because they travel a lot and they are exposed to a longer time of gravity, which will affect their soft palate. So what exactly we do in Alexion? We apply the laser on the soft palate, on the mid right and on the mid left, and in the middle of the uvula. When the laser is absorbed by the soft palate, it will produce collagen. When the collagen is produced in the soft palate, it will make shrinkage. It will pull up the soft palate, and then it will open the airway of the patient. So here is the picture before. This is the first session after you apply the laser. Then here is the second session after 6 weeks. And here is the third session after, again, 6 weeks. So each session will take 25 minutes. Between each session, the patient will rest for 6 weeks because the collagen in our body needs around 4 weeks up to 6 weeks to be completely produced in our body. The advantage of this snore treatment is not because the patient makes some voices when he sleep, but it is because the patient doesn't receive enough oxygen while he is sleeping. So on the long term, he will complain from, he will have some damage to his brain cells. Sometimes he will have some Alzheimer's. So we treat the people who complain from snoring to protect the cells and deliver enough oxygen to their cells when they sleep, not only because of the sound of the snore. And this is the final slide of today. It was my pleasure to speak to you, and I hope I can travel to Myanmar very soon to meet you. I just want to add one last point is we have something called the study club. The study club of Alexion, we usually post a lot of cases. We teach you how to use the laser. We also make regular training. So I hope next year we will be able to make around 4 or 5 trainings locally inside Myanmar to show you how to do the application on the patient. If you have any questions, you can write it on the chat, or you can simply ask me. Question is about relieve the pain during anti-snore therapy. Actually, the patient is not going to feel any pain because we don't apply any. We don't. First of all, we don't apply any anesthesia. We only apply the laser with a very, very low amount of power, just to improve the production of the collagen. So it is not painful at all to the patient. It is only the patient will feel some kind of a small change of the temperature, so a little bit heat, but it is not painful at all. It is something like you have drink something hot, so that's it. But it will not be painful at all to the patient. Usually, all of the low-level laser therapy or the biomodulation are not painful at all. The patient will not feel any pain at all. There is a question about the metal crowns. No, it will not make any damage to the surrounding tissue. Because when the laser is reflected from the metal crown, the reflection of the laser is not very high. So the energy which is reflected from the metal crown to the surrounding or to the neighboring tissue is very, very low. It doesn't have the ability to cut or make any damage. This is the first point. Second point, the laser is not harmful. So when we apply low-level laser therapy on the patient, on the tissue, it will not make any damage. It will only improve the activity of the mitochondria and the fibroblasts. So it will not make any problem for the patient in case you have a metal crown near to the operation site. So don't worry at all. You can apply it near to the metal crowns. Yes, regarding the presentation, I will send it to you, but please, you can send me a message on my email or Facebook or any application, so I can send it to you. Okay, there is a question about, can the patient feel tooth sensitivity of laser touch the tooth? Okay, the patient will feel sensitivity if you are using a very high power and if you are working 90 degree on the tooth, because 90 degree means that the laser will be focused on the tooth and it may cause some pulpitis. So when you are using dyed laser, try to be away from the tooth surface, or try not to stay for a longer time on the tooth surface, just to avoid making any pulpitis. But if the patient have, let's say, for example, you have a patient who complained from hypersensitivity and you want to treat it, you can use the laser with a very, very low power, and you can use a desensitizing agent such as a fluoride or something, but use a desensitizing agent which is photoactivated or laser activated. You will apply it on the tooth and you can leave it for 2 minutes, and later you use the laser to activate the gel. This is how you can treat the hypersensitivity. Yes, you can use the laser to treat the herpes. You are welcome. If you have any questions, you can simply ask me. I am uh, available for that. I just want to make sure, is there anything not clear for you, something you could not understand? Today the presentation was a little bit short. Usually we make an advanced dental course. We will make it soon in Myanmar, I think next year when the airport is open. The advanced course, it will be for 2 days. It will be a certified course in which we will teach you everything you need to know about laser, not only about Alexion, but in general, what everything you need to know about dental laser, how to use them, which is the best wavelengths for which application, and so on. So we will organize that with Mr. Wang and O'Donnell Smith next year. Directly after the airport is open, we will have a certified laser course for 2 or 3 days to teach you everything you need to know about dental laser. And this course, usually it is going also to be translated. So it will be in English and it will be also in Myanmar language. Thank you so much for today.